Welcome to today's presentation on Updox and STRAND, care coordination to reduce asthma incidence and improve adherence and enhance patient engagement. My name is Katie Lashy and I will be moderating today's event. You've probably noticed that the phone lines have been muted. We are recording today's presentation and we would be happy to send that presentation and recording around after the event. We will be taking questions at the end of today's presentation. There's a questions section on your GoToWebinar panel where you can type and submit your questions there, and we'll get through as many as we can. I apologize for the audio issues getting started today. I hope you were able to see that phone number included in the chat section on the GoToWebinar panel. So let me go ahead and introduce our speakers for us. Our presenters today are David Pope. He is the Chief Innovator and Co-founder of STRAND. STRAND is a rapidly growing suite of technologies that bridge clinical pharmacy with the retail landscape. STRAND is a first-of-its-kind clinical intervention system designed to document, communicate, and bill for a pharmacist's clinical services, such as diabetes education, tobacco education, office visits, and more. Sean Ramsey is our VP and GM of Pharmacy here at Updox. Sean brings 15 years of experience in the healthcare technology space, and Updox was created to simplify the business of healthcare. So if you think through administrative strains in the pharmacy space, we try to clean up the paper-based clutter, time spent on phone, and then in pharmacy specifically, open up revenue opportunities for you, making it easy for you to offer more of those clinical services. So without further ado, I am going to go ahead and hand it off to David Pope.
Great. Thank you so much for joining today. Again, I know how busy you are. I'm a pharmacist myself, and I still practice in the community space. And so, again, if you're on the East Coast, that's 1 o'clock. That's, again, it would be a pretty good time for lunch, by all means. I know as a community practicing pharmacist, many times it's a 2:30 or 3 o'clock type of a lunch. And so grateful for you today to spend some time talking about asthma, how you can engage your patients, and how you can leverage the power of both Updox and STRAND to be able to improve outcomes and also improve the bottom line of your pharmacies. Now, as you may not be aware, asthma is actually the leading cost driver for the majority of Medicaid across the United States today. You would think that would be something like cancer or diabetes or others, but unfortunately, it is asthma. Asthma is, as you can imagine, it's many times is a juvenile disease, but it does extend past juvenile. In fact, you can still get and attain asthma, develop asthma over time. I can raise my hand and say I personally have developed asthma later in life. And so, again, I have to take a Singulair every single day because of my asthma. But one of the things that we've noticed is that if we look at state Medicaid, who has a younger population, of course, as well as an adult population there as well, is that asthma is the leading cost driver for that across the country. It's incredible to see the numbers there in terms of that as we go to the next slide. And again, one of the things that we've noticed is that Medicaid are in the business of assisting in improving those opportunities for pharmacists to be able to engage. They're even willing to pay pharmacists for that. And so, for example, if you live in the state of Virginia, if you live in the state of Missouri, pharmacists can get paid for asthma education. So again, it's an important thing to be able to do, to be able to focus on asthma, because everyone is focusing on it as well, and there are dollars available for you. So as we look very quickly at STRAND, just as a very quick update here, one of the things that you can utilize within the STRAND platform, if you're already a STRAND user, you probably already know these types of things. But if you're not, this is just something to get acclimated to that. So through STRAND, this is an electronic health record that you can document the clinical things that you provide, communicate that through Updox. It's a strong partnership there. Is that we show strong engagement. Why? Because we're built within your workflow. So as you're engaging with your asthma patients, again, whether that's the end result is to submit a claim or to perhaps offer some clinical service and then submit that to the rest of the healthcare team or to a payer for billing. It's all done through STRAND. We work in all 50 states. We're the #1 pathway in the country for DSME, which is diabetes self-management education across the country. When pharmacists engage for with STRAND, on average, they add 8 clinical services. One of them is asthma management. So as we go to the next slide, we'll take a look at the clinical workflow. The clinical workflow is very key. Especially as you are looking at your workflow on a daily basis. How can you personally engage with your asthma patients in a consistent workflow? Because what we do know is that if it's not in workflow, at least if it is for me in my pharmacy practice, then it doesn't fit very well, and so it doesn't tend to happen. So this is a clinical workflow that's not just built for asthma, but it's also built for any clinical service that you provide. Perhaps that's opioid abuse prevention and education, or diabetes or prediabetes education, tobacco cessation, point of care testing, so many different things. This is a clinical workflow that typically happens within the pharmacy space. So the first thing that you can do is to prepare. You can prepare in multiple ways. First of all, you're on a webinar today to learn more about asthma and engaging with asthma. Did you know that there's actually an asthma certification that you can receive? It's the AEC. And so if you are interested in doing so, it's the Certified Asthma Educator. You can go and complete that. There are a few payers that require it. Most don't. But again, that AEC may be something you want to look into. The second thing you can do is to prepare by getting credentialed and contracted for clinical services with a payer. Pharmacists are now engaging for clinical services with payers for the medical side. So again, they are receiving contracts, not just through their PSAO for medications, but also for clinical services. And certainly the preparation of that is vital and is necessary. The next thing you can do is identify your patients. Again, living with asthma, living with another chronic disease state, and you can utilize STRAND to be able to do so. Then it's a time to engage with them. You can utilize the myriad of services through Updox. I'm just continually amazed by the utility of Updox services, especially as they engage the patient as well as the provider. And we'll hear more about that in just a moment. So the next thing it's time to do is to bill, document, and communicate it. You can actually bill for that clinical service all through STRAND. Billing for a clinical service such as asthma education or perhaps another medical service can be done through STRAND. It is not, however, going through NCPDP usual format. That's a road that pharmacists utilize, but the rest of healthcare actually does not. So every hospital, every physician uses a completely different road. Think of this as I-95 if you're on the East Coast versus I-20. One goes north-south, one goes east-west. And so therefore, there is a new pathway. I say it's a new pathway for pharmacists called X12. You're going to be hearing more and more about this. For example, Relay Health, who the majority of you most likely uses a switch for for pharmacy claims, is entering into the medical claims business as well. They're going to be submitting X12 claims soon and very soon. There are other entities who do that already. STRAND is one of them, and so we're excited to be able to do that. By the way, that Relay Health piece, pretty cool. You're going to be able to bill in any pharmacy management system out there for that X12 or medical claim, and then you'll receive a link back to STRAND. So they've selected STRAND as their documentation provider of choice for that. Then it's time to intervene and document. And what we're about to talk about is how you can intervene within your asthma patients. And I'll show you more about that in just a second. And then finally, the one thing that we have to make sure that we do is communicate your documentation with the rest of the healthcare team. And that's where the power of Updox comes in as well. Again, you're documenting in STRAND, but it's time to communicate that with the rest of the healthcare team. And so that's, again, the final piece of that clinical workflow. So as we look towards the impacts of asthma as well, just one more time, just to try to go through this as well. In 2016, 26.5 million people have received an asthma diagnosis in the United States. And if we can go to the next slide, I think that will display these numbers here. Actually, almost 6 million, or just over 6 million of them are actually children, but another 12 million, again, have reported having another more than one asthma attack the past year. Oh, it's unbelievable numbers there. And it results in 1.7 million ER visits, and that's just a few years ago. Again, people have an asthma attack and they don't know what to do. I've had one myself, and it feels like breathing through a straw, just like everyone told me in pharmacy school it would feel like. And again, it's a frequent ER visit. But what if we could engage with that patient again and ensure that they're on their controller medication, ensure that they're able to use that rescue inhaler when necessary, that we've provided a care plan for them, all of those things. We can truly reduce ER visits. The one stat that I love shows that basically when pharmacists get involved in asthma training, outcomes improve. And so again, the dollars that you see here on this slide of $80 billion of medical expenses and missed work days and all of those things, direct and indirect costs of care there. Again, you can make a measurable impact in the lives of your patients. So what does that look like practically? We've created something called the STRAND pathways. And so for asthma, for example, there's a walkthrough of what you could do to not only determine are the drugs right, but also are the drugs effective. And that's on the next slide. So if we look at month 1, what can you do with the patient who says, I have asthma? Now what? What additional thing can you do with the partnership in STRAND and Updox? The first thing that you can do is review the medication list. You can add disease states. You're going to educate them as well. We actually have education built into STRAND for you to be able to teach. Not only that, but we have something for parents. If this is a juvenile, for example, we have something for parents and for teachers, again, so that whenever you have, if the child has an asthma attack, we can know that we've informed the student's parents as well as the teachers of what to do in the event of attack. I can't help but think of a time when I was a young pharmacist one time who heard of a patient of ours who died of an asthma attack. Unfortunately, they were also pregnant, and the asthma, that when they found her, they actually found her with an albuterol. She was not able to reach it in time. Her family did, but her family didn't know how to use it. Her family wasn't aware. They weren't sure if it would hurt the baby either. And as a result, that patient died. And from that point forward, that's been a big motivating factor for me personally to be able to show the impact of of asthma education. And so again, through STRAND, that education is actually built into STRAND. So you're determining basically, are the drugs right, month 1? And the second thing is that you're empowering that patient with the education. Now, on top of that, we also have additional screenings, month 2 and month 3, and even following, that will help you in your engagement with those patients to not just determine are the drugs right, but ultimately are the drugs effective. So as we go to the next slide, you'll see actually our education. Not only our education, which again is graphically designed for your patients, but also you'll see an asthma action plan. You can actually complete the asthma action plan all within STRAND. This asthma action plan is very important. And it's not just important for you, but also to the physician. So for example, every physician in the country is now held under the same type of pay-for-performance type processes that you and I are under STAR ratings. They have something different called MACRA or MIPS as well. But one of the things that I've noticed is that, in fact, I've got a great friend who's a pediatrician who said, I am getting penalized on my reimbursement because my asthma patients are not taking their controller medication enough and their rescue inhaler too much. In fact, there is a measurement system called HEDIS measures, H-E-D-I-S. You should know that term because you make a great impact on them. One of the HEDIS measures that is not only passed down to payers but also to physicians as well is the ratio of controller medication that's filled versus rescue inhaler. As you can imagine, that rescue inhaler should be filled much less than the controller medication. In fact, there's a specific ratio. It shouldn't be your rescue inhaler shouldn't be filled, but every other time. I can imagine and can think back to a time whenever I've seen patients come in and receive 3, even 4 boxes of albuterol. We tape them all together and or label them individually. Again, those days are over, because we want them to ensure that they are adequately controlled on a daily basis with their controller medication. What does that do? That decreases the ER visits. And so that, along with an asthma trigger checklist, is actually built into STRAND. And so as we go to the next slide, you'll see a little bit about how you can do those types of things. And so we've got a patient chart here that we've pulled up. Again, so you're in STRAND. You can actually pull up your patient, by the way, normally through your pharmacy management system. We now have bidirectional and single sign-on communication with the majority of pharmacy management systems, I believe like 85% now. And so you can be in your pharmacy management system, click on that STRAND icon, and it will take you right to the patient chart. At that point in time, you start an encounter. You then assign that patient to a disease state, and that would be asthma. And all of these new opportunities begin to pop up for you, such as the education. So you don't have to go search for your education within STRAND or within any other solution there. Again, whether that be paper-based or anything else. It's just all right there for you. It even assists you in the documentation of doing so. You have a patient handout that you can give to the patient that not only tells them about what you discussed today, but also has a letter to the parents and the teachers, all of those things. And if it's a juvenile patient, we even have one that while you're teaching them is a little piece of origami. So they can actually be folding it and write it on the side and do all of those things to keep them engaged. The asthma triggers checklist is all built into there as well. So for example, you can go through the patient's home. In fact, there is one state in the state of Missouri, for example, that will actually pay for that review inside the patient's home, a pharmacist to do so, to look and see what are those triggers that might be increasing the risk of asthma exacerbations, again, such as certain types of pillows, filters, and the like. The one thing I would say is that we've got to utilize this data in a great way in order to further tell your story. And so as you are documenting in STRAND, you are also developing a story that says that when I get involved, outcomes improve. And so it's part of the mission of STRAND is to be able to tell your story. And so I can't tell you the number of consistent meetings that we have with payers and others that are so excited about this in particular, simply because, again, they are able to see the clinical and financial, honestly, impact of even paying you for those clinical services. And then finally, I will say that documentation, it should not continue after that patient leaves. It's got to be done within your workflow. And so that's the joy of STRAND combined with Updox allows you to be able to do just that. Which brings us, again, to 2 final points here. First of all, once you're done with this communication on a monthly basis, communicate this with the rest of the healthcare team through Updox. So we have a complete Updox integration. So if you have STRAND, again, you can go up to the top right-hand corner, click on that on the envelope icon, and it will single sign on you right into the Updox pathway as well, where you're able to communicate with others on the healthcare team. Again, this has been absolutely critical for our pharmacists who are engaging with clinical services, is not just to keep that data siloed to yourself, but to be able to communicate that, whether that be the medication list, asthma action plans, care plans, asthma triggers checklists, and all of those things. And then finally, as I turn this over to Sean Ramsey as well, there's always the question of what can I get paid for? And I just wanted to quickly provide you with a new resource that we have within STRAND. And that will help you determine the size of the prize. If I'm going to engage in this type of service, whether it be asthma or DSME or any other opportunity there, what kind of revenue is potential for me? Because this new idea of medical claims and medical services is brand new. You can check that out and develop your own personalized return on investment at learn.strandrx.com. So with that, again, thank you for your time today, and I'd like to turn this back over to Updox.
Thank you so much, David. That was a great presentation. Just a quick reminder, we will take questions at the end of today's presentation. There is a question section on your GoToWebinar panel. You can type and submit them there. And now I'm going to kick it over to Sean Ramsey.
All right, thanks everyone for joining us this afternoon, and especially thank you, David, and the STRAND team, not only for partnering with us, but also for really being one of the drivers in the industry to help get provider status for the pharmacists across the country and give them critical new ways to improve their revenues across their pharmacies. So jumping on in from the Updox perspective, so obviously we've built a specific set of pharmacy solutions to really meet the needs that you guys are faced with every day. And we realize you're all incredibly busy with everything you have going on in your stores. We really don't want you to have to be hopping around between several different solutions to accomplish the goals that you need to, whether they're administrative, whether they're trying to engage your patients outside of the pharmacy itself, or coordinating with other providers in your community, which is obviously critically important to share that information between hospitals and primary care physicians and specialists and pharmacists like yourselves. But then also, as part of what the conversation's about today, is giving you a way to efficiently drive clinical services revenues, which is something that you obviously can't do fully manually, and you need value-added services like STRAND and Updox to help you accomplish that. Next slide, please. So what we want to talk a little bit about as a supplement to the STRAND solution is engaging your patients from a mobile perspective. And as you know, everyone, pretty much almost everyone, as you can see here in the country, has a cell phone today, even senior citizens, who many people say that they don't use it, but I can tell you my default way to communicate with my 75-year-old father is with my cell phone and texting him back and forth. And so, you know, what they're saying is over 90% of text messages are always read within 3 minutes. And if you think about it, people have it with them 24/7. They put it on their nightstand at night, and that's the first thing they check when they wake up in the morning. And obviously, this becomes a more efficient way to communicate with them outside of the pharmacy itself when you're face-to-face than trying to call them on the phone, which can take up a lot of your staff's time and not really drive the value that you need. And then finally, you know, a lot of times we all have short attention spans, and it's probably made even shorter by the phones. But a lot of times they're not going to retain all the information that's been provided to them in person or on the printouts that come along with the prescription bags when they're sent home. And so this is a way to really help engage the patients where they always are, which is attached to their cell phones. And we want to really help do that to help support and drive some of these adherence initiatives. As David talked about, we don't want them to always hit the rescue inhaler. We want them to make sure they're staying compliant with their normal asthma medications, which is critically important for them to stay healthy. And so we can use this in a variety of different ways to help engage those patients as a supplement to when they're in your stores. Next slide, please. So as we're talking about this support for the patient asthma care, obviously we've partnered with the best of breed company in the space in STRAND, and what we want to really make sure we're focused on is how can we supplement what you're doing when you're documenting these clinical services when you're with the patient. And we want to be able to give that patient the visibility they need when they are at home and they're not in front of you, to help support them in these efforts to be compliant with asthma and the other programs that you might embark upon when you do these clinical services, as David mentioned, like the diabetes self-awareness programs or smoking cessation or whatever it might be. And so we obviously want to make sure that from your pharmacy's perspective, you are engaging with them, but you're also staying compliant. There's a wonderful thing called HIPAA that we're all well aware of. And so we wanted to go out and build additional solutions to be able to help you meet the HIPAA compliance guidelines, but also be able to share that sensitive data with the patient in a secure way, but also a convenient way for them to be able to get that. Next slide, please. So that's why we set out to build a secure SMS, or an SMS and a secure SMS texting solution. And so this allows you from, as David talked about, from the solution that you're normally logging into every day, your pharmacy management system, to be able to use Updox to be able to communicate directly with your patients. And these can be just simple one-off questions that you're trying to get answered from them, or just individual information that you want them to bring back with them when they come into the pharmacy to see you. And so we've been able to do this where you can do it across multiple different channels to be able to communicate with the patients once again on their cell phones, where they're always have it alongside them. Next slide. We realize that in some cases the conversations could turn into a very specific medical conversation, and so that's why we've added secure texting. So this is a way it's going to work with their existing cell phones, but it is going to put those conversations into a HIPAA compliant container, if you will. So there you'll be able to share attachments with them, have them fill out forms with very specific medical information, and know that you're still staying within the guidelines of HIPAA. We've even built it so that if you have an initial texting conversation with them and it does start to go down that path, you can very easily switch over to make this a secure HIPAA compliant text as well. One thing that we are working on for this next, because we realize it's important to communicate with them, but you also want to make it easy for them to reach back out to you if they need to call you, is upcoming we'll be releasing the capability for you to be able to text folks from your actual pharmacy office number. So they'll recognize that number as yours, and if they do happen to call you instead of text you back, it actually will dial back into your store as opposed to a random number that you might be assigned. So that's one other thing that we've been working on. Next slide, please. So real quick, we've had a lot of success with this already. So just an example of one of our pharmacies that we've been working with, who's found a lot of value in using this service for us. And so it's obviously been able to help increase their revenue and help take people off the phones to be able to do things as simple as refills, but also be able to drive potentially additional clinical services as well, to be able to bring more people into the pharmacy. In addition to that, we have the capability for you to be able to collect information from your patients remotely through our online patient forms, which is a part of our patient portal solution. So once again, if you need them to fill out any type of information, they can do it on their own time, they can do it at home, they can do it on their cell phone, and all of that data will come back into the same place in Updox where you will be receiving those text messages, you would be receiving those the actual patient files coming back from physicians potentially if you're using the STRAND solution. So just a way to really help collect additional valuable information from your patients without having to have them fill it out there inside of the pharmacy. So we've even had certain folks be able to do type of education programs like an asthma program and be able just to collect the information up front just to make it a more efficient process when they come into the pharmacy. And then finally, we've been also working on ways to help you reach out to different segments of your patient populations. So this could be something as simple as, we're going to be closed for inclement weather. It could be something as far as letting them know that the Shingrix vaccines are now in, but also along the asthma track, focusing on just that subset of patients who are on asthma maintenance medications, and you want to get out relevant information to them to help making sure they're being adherent with their programs. But you don't want to have to do 150 individual messages. This will give you a way to kind of build some content and make templates out of that content and be able to send that out to your patient population that meets that specific criteria. So once again, all these things are built into a single solution, but really the goal is to help augment the things that you're doing today in your pharmacy when you're starting to embark upon some of these clinical services programs that STRAND does such a great job of being able to present for you and get you credentialed to be able to be paid and recognized for your time and efforts to do so. So with that, I'm going to go ahead and wrap it up, and we're going to open it up for questions. So I'm going to turn it back over to Katie tomorrow.